This is Ray Madigan. I'm one of the sales managers here in Minnesota, and I'm going to talk to you about Humana's Medicare Advantage plan for Education Minnesota. So there we go. Okay, Humana, we're a Fortune 500 company. We're in all 50 states. I have been doing this for almost 50 years, over 50 years, as a Medicare Advantage plan, offering coverage for people across the country. We have over 8 million Medicare Advantage plan members in the country. We've been in Minnesota for roughly 14 years. We are a PPO versus an HMO or a cost plan. What that means is you have the ability to go both in and out of network. You have one cost share in network, a different cost share out of network. You will pay a lower cost share if you stay in network. We also have doctors in all 50 states. So because we're a national carrier, if you're traveling, if you spend time in Arizona, Florida, Texas, wherever, you can access our PPO networks in those states as if they're your PPO network here in Minnesota. The same copays, the same cost share, it all rolls up to the same max amount of pocket as well. Okay, I went the wrong way, sorry. Okay, we have two plan options. The first is our low PPO. It's $45 a month. That's going to have a $5,900 max amount of pocket. It's going to have a $360 per day, days 1 through 5 copay for the hospitalization. It's going to have a $10 copay for the doctor, $45 for the specialist. It's going to have durable medical equipment of 17 to 20%. ER is an $80 copay. Urgent care is $25. The plan also has vision at a $75 coinsurance. We're going to recover $75 towards the exam and $100 towards lenses. It has a hearing aid benefit through True Hearing. Actually, it's also on our high-end plan. It's a true concierge service through True Hearing. It's an 800 number. You call that 800 number. They will schedule a hearing aid exam with a local provider. You will then have either a $699 copay or a $999 copay for a set of hearing aids. For hearing aids, one per ear, 2 ears per year, if that makes sense. So you get 2 hearing aids at $699 or $999 a piece. Okay, and that's done through True Hearing. They do follow-up visits as well as batteries. And then we have a built-in dental benefit. This plan has a $50 deductible on the dental, and then you have $2,000 worth of dental benefit. $0 coverage for preventive services and exams and x-rays, upwards of 50 to 70% coinsurance for extractions and crowns, etc. like that. Okay, and again, more detail I can give you later on when we're one-on-one. It does have a built-in drug benefit, as I mentioned. Got to make sure I stay with the microphone, sorry. There's a $280 deductible. Then you pay a $4 for tier one generics, $47 for tier 2 drugs, 50% for tier 3, and 27% for tier 4. You'll notice that our mail order cost sharing is a $0 for tiers 1 and for the tier 1 drugs. That's through Humana Pharmacy. You'll also save $10 copay on the tier 2 through Humana Pharmacy. That is our low-end option. Our high-end option, it's new this year. This has a $3,000 max amount of pocket. Okay. On both plans, there is no in-network deductible. There is only an out-of-network deductible. That out-of-network deductible is $1,000. It does not apply to in-network services. Okay. This has a $3,000 max amount of pocket. Out-of-network is $4,500. Hospital is $100 per admittance. Primary care is $0. Specialist is $25. Ambulatory surgical center is $25. Durable medical equipment are 20%. ER is $100. Urgent care is $25. This also has the same hearing aid benefit. It has the same vision benefit. This dental benefit, however, does not have a deductible. Okay, and you have a lower cost share on some of the more intensive services like dentures and root canals. Both of them have, again, $2,000 worth of dental benefit. This has a $250 deductible for tiers 2 and 3 and 4. No deductible for the generics. $4.47 at the local pharmacy, or through Humana Pharmacy, a $0 co-share for those Tier 1 drugs. How many of you have ever heard of Humana Pharmacy? Some of you may have heard of Humana Pharmacy. That is our in-home, it's a pharmacy that Humana owns. Some crazy statistics. 68.4% of people on Medicare have 2 or more chronic conditions. 3 out of 4 people don't take medications properly. 700,000 admittances to the emergency room result for not taking medications properly. By having a 90-day mail order supply of your medications delivered to your house, you increase medication adherence by 1/3. That's one of the reasons that Humana has a $0 cost share for our mail order pharmacy. We don't want you to not take those maintenance medications. Okay, it's going to save you in the long run. How to enroll? As with all other plans, we have applications you can enroll. I do not have kits at this point. Tim may be getting them shortly. We will be getting them shortly. We're just a little behind on the curve when it comes to Education Minnesota approving the policy and getting our stuff out. What to expect after you enroll? Again, you're going to get your card. You're going to get a follow-up visit. You're going to get a follow-up phone call from us to help you manage any any certain healthcare concerns you may want to set up, and you will get your evidence of coverage. Physician Finder, again, I mentioned we are a national company, so we have providers in all 50 states. We have, like these guys, the majority of the care systems here in Minnesota, Hartnick, Alina, Mayo. You need to be a resident of Minnesota to enroll in a plan, but you can use it in all 50 states. Again, as a travel benefit, you don't need to tell me you're moving. You don't need, or not moving. You don't need to tell me that you're visiting your relatives, spending time in Arizona. You just go and do what you need to do as you need to do it. We also have additional services. We have Humana at Home. That's a home-based service for people who have certain chronic conditions that need additional services at home. We have health coaching. We have Humana First. That's our 24-hour nurse line. We have points of care. We have My Directives. We also have Welldine. This is a delivery service for meals post-hospitalization. You're in the hospital. You come out of the hospital. You're going to be followed up with a care nurse. That care nurse will help set up 10 frozen meals sent to your house, kind of like Omaha Steaks, but not Omaha Steaks. You get that service 4 times a year in the event that you should be hospitalized 4 times a year. We also have Silver Sneakers. Again, national membership, multiple clubs across the state and across the country. We have Humana Rewards. That's a rewards program that allows you to earn points and gift cards for healthy behaviors. We also have telemedicine available. On the high-end plan, it's a $0 cost share to have unlimited conversations with the telemedicine. On the low-end plan, it's a $15 copay. You also get our Smart Summary that is available by mail and online. We also have the ability for you to set up a portal on Humana's website called My Humana, where you can, again, manage your account and see your claims. We have our toll-free number. Questions?